can you just tell us a little bit about what your role is with Planned Parenthood Arizona?
Sure. Yeah, I am a family nurse practitioner. I provide family planning services at our Tucson location. So, birth control, STI screening and treatment, infection checks, cancer screenings, things like that.
Okay. And what are you seeing on the ground right now as a result of COVID-19?
Yeah, that's a great question. Things certainly have changed a little, but what I have primarily seen is, our patients are, you know, experiencing this pandemic just like we are, right? Day to day basis. Um, what I've specifically seen is individuals coming in to Planned Parenthood and being very grateful that our doors are open, right? Because their primary cares are triaging their appointments. So maybe their birth control refill appointment got postponed or canceled. So I'm seeing lots of individuals coming in, grateful that they're able to get that service with us. I'm also seeing people coming or women coming in to have their IUDs or their Nexplanon implants changed out a bit early. And the reason for that is maybe they lost their job or they know their insurance will term soon. So they're trying to get in and get those highly efficacious forms of birth control changed out now while they still can. We're also, making day-to-day adjustments to how we provide care, right? We want to make sure that not only our staff are safe, but also our patients are safe. So one thing that we've implemented is offering up to 6 months worth of birth control refills over the phone, as opposed to having them actually come into the clinic. So that just decreases a little bit of foot traffic and also protects our patients from, potentially exposing themselves. Let's see what else. Lots of things, right? Yeah, just taking it one day at a time, trying to stay on the, whatever the CDC is recommending and making sure that our patients are cared for in light of all this.
Is it hard to stay like really up to date on those guidelines as they're changing so regularly?
I don't think it's difficult. We have a fabulous team of people who are meeting several times a day and making sure that all that information is disseminated from the top down. So I certainly feel confident in that, we as an organization are, responding quickly and responding well. Yeah, so.
Good. Why is it so important for women to continue to have access to family planning, healthcare services, especially during this time?
Oh yeah, during uncertain times like this, if you are a sexually active woman who may not be ready to parent, I think it is incredibly important that they have access to their birth control options, right? And so your birth control pills need to be refilled. You don't know if you're going to be able to leave the house in 2 months. So things like that are super important. And again, going back to the IUDs and Nexplanons, is it going to expire in the next couple of months? And will you be able to access those, sometimes costly forms of birth control without health insurance? So, what I think is great is that, the Tucson community, the women of Tucson can really trust that Planned Parenthood is going to be there for you, be there to have, provide that access to those forms of birth control. Our services are confidential, they're affordable, and we're here to care for them in a safe environment.
Good. What advice would you have for a woman who, maybe lost her job, is losing her health care, and hasn't been to Planned Parenthood before?
I would say, give us a call, see what we can do for you. Come into the clinic, see what we can do for you. Yeah, we definitely have affordable options, specifically our care funds, which allow us to provide birth control counseling at a decreased cost. So, that we definitely have things in place to help women who may be underinsured or uninsured or even unemployed at this time. So give us a call for sure, or visit our website, ppaz.org. We're here for you.
Great. The other thing people can do at ppaz.org is give. Is that correct?
That's absolutely right. Yeah. And, circling back to that care fund, that is something that, if you're looking to do a little bit for your community, donating to that fund really helps us provide free birth control counseling and sometimes even options to those who are at most need.
Are there other ways that people can get involved if they want to help right now?
Yeah, I would say, again, making donations at ppaz.org, continuing to make donations to, Women's Foundation of Southern Arizona for everything that, they do for us in our community. I would say making sure you're registered to vote in the upcoming general election, right? We want to make sure that our elected officials support access to all kinds of healthcare, right? And, just continue to support and uplift the women and girls in our community.
That's all great advice. Thank you.
Thank you.
What are you doing personally to care for yourself during this time?
A big thing is, supporting my community like I've always done, but continuing to do that with an, upbeat, trying to stay upbeat, right? Trying to stay optimistic in these uncertain times. I certainly want my patients to feel or, confident and comfortable when they come into the clinic to see me. So I need to feel confident and comfortable. And then also just trying to maintain a normal routine. My partner is home working from home, so supporting him and everything that he's having to go through, taking care of 3 dogs when I'm out of clinic. But other than that, I think the big thing is just trying to keep in mind that this too shall pass. And, in the end, I think we're going to come out a much stronger and well kind of connected community.
Yeah. Can you talk a little bit more about the kind of health and safety precautions that you're taking at the clinic? So I know you said that people are, you're doing more over the phone. What about the people who you are seeing face to face? Can you just talk about that experience?
Sure. So we are taking time. I mean, of course, we're always following universal precautions, right? So what the CDC recommends as far as cleanliness and, disinfecting and things like that. So we are 100% following those guidelines, and we're just, day to day making adjustments based off of those changes. We're disinfecting our lobbies, we're disinfecting our counters more often. We are doing some social distancing in our lobby, so don't be alarmed if you come in and see certain chairs taped off. So those are just things that we're doing to make sure that our patients are safe when they're waiting for their appointments and when they're actually in the clinic. Just little things like that.
Who are your superheroes? Who's inspiring you right now?
Inspiring me right now are the 3 fabulous medical assistants that I work with on a day-to-day basis. These 3 women are on the front lines with me every single day, providing, quality, non-judgmental care to every single person who crosses our threshold. They are, in my opinion, brave and, unnerving. They're wonderful, and I'm very, very grateful to have them by my side every day.
That's great. Any other thoughts, anything you want to share with the folks who are listening?
Remember that we're here for you if you need anything. Our reproductive healthcare needs don't change just because, of this virus and these times. So if you need anything, please come and visit us. We're here, our doors are open, and they will stay open.